Secretary to the Government of the Federation, members of the Presidential Task Force on Response to COVID-19, ladies and gentlemen, as of today, the 30th of March 2020, we have recorded 111 confirmed cases of COVID-19 in Nigeria, of which 68 are in Lagos, 21 in the Federal Capital Territory, 7 in Oyo, 3 in Ogun, 2 in Bauchi, 2 in Edo, 2 in Osun, 2 in Enugu, and 1 each in Benue, Ekiti, Kaduna, and Rivers states. Majority of them are persons who came from overseas, and the others have been traced as close contacts of such returnees. The high number of imported cases in Lagos and Abuja is directly due to their function as country gateways for air travel. Till date, 3 persons have been discharged after successful treatment, but sadly, another fatality was recorded over the weekend in the person of a patient who had severe underlying illnesses. We have intensified contact tracing, and our strategy remains to promptly detect cases, isolate them, and follow up with their contacts, and also isolate and treat in order to reduce the spread of the infection. The Federal Ministry of Health is working closely with states and the Presidential Task Force on COVID-19 to review response activities and to institute measures to protect the health and well-being of Nigerians, while the NCDC-led Multi-Sectoral Emergency Operations Center continues to coordinate national response activities. The NCDC has expanded its capacity by engaging hundreds of ad hoc staff to support various areas of response, including the call centers, contact tracing, and follow-up of persons of interest. On the order of His Excellency the President, all retired but essential and able-bodied staff are to be recalled to service at this crucial period. In addition, training is being conducted for medical personnel to support overall preparedness and response activities to prevent the virus from spreading further into other states. We have identified about 1,000 beds in Abuja that can be put to use immediately as isolation centers if the need arises. Capacity to increase bed space is present. President Muhammad Buhari has approved resources for procurement of required commodities. We're also working hard to open up as many testing sites as possible, and with new additions to the case definition, persons with fever and either cough, difficulty in breathing, or shortness of breath who are in areas of high COVID-19 prevalence can test for the disease. The NCDC has added a new laboratory to its network of molecular diagnostic laboratories for COVID-19 at the University College Hospital, Ibadan. Within 3 weeks, 7 more laboratories will be added in Abakaliki, Kaduna, Kano, Maiduguri, Port Harcourt, and Sokoto to further expand testing capacity nationwide. Members of the public are to note that testing is free of charge, is at no cost to the public. Anyone demanding to be paid or to be given a tip should be immediately reported to the appropriate authorities. Unless you have been tested in one of these 6 laboratories, your results are most likely not valid. If you think you fit the case definition of a suspect case, please call NCDC or your state hotline for immediate testing as the only way to ensure you get suitable treatment. As the situation evolves, we shall need to focus our resources on persons who actually need the test most critically, from the testing time to treatment. I wish to remind citizens of the importance of following the recommended protocol to request testing so as to prevent further exposure and spread of the virus by those who are infected with COVID-19 and who are not able to test. During his address to Nigerians yesterday, His Excellency the President announced the lockdown of non-essential activities in Lagos State, which is the epicenter of the COVID-19 outbreak, the FCT, which has the second highest number of cases, and Ogun State and Oyo State, given their proximity to Lagos. This is effective from 11 p.m. today, 30th of March 2020, for an initial period of 14 days. In the absence of a vaccine, preventable measures such as social gathering have proven to be highly effective in curbing the spread of the disease in other parts of the world. It is therefore one of our major containment strategies in Nigeria. Directives have been issued at national and state level to cancel all large gatherings, including religious, social, and political congregations, and also to shut down schools and event centers. While train stations, land borders, and international airports remain closed, precautionary measures are also being taken by the federal government to protect our seaports. Only ships that have been at sea for more than 14 days can dock in our ports after the crew members have been confirmed to be healthy and negative for COVID-19. An exception to the 14-day restriction on vessels applies only to those carrying oil or gas products, where the human interface between the crew of those ships and the shore is absent or insignificant. These measures may cause inconveniences, but I urge all citizens to accept and practice them in good faith, as they are necessary for our common good and in the interest of all of us. The earlier we collectively take responsibility, the sooner we can go back to living our normal lives. The federal government has announced means of mitigating the effects of these lockdowns, including provision of relief materials and other financial policies. Importantly, this fight against COVID-19 is not for the government alone, but for all of us. With a few simple steps, you can take responsibility and also join the collective effort against the disease. And as always, I will mention them here again. Frequently wash your hands with soap and running water for at least 20 or 30 seconds, or use alcohol-based hand sanitizer. Maintain a social distance of at least 6 feet between yourself and other people, especially those who are coughing or sneezing. Self-isolate for 14 days if you have just returned to the country, in line with the 40-day law. If during self-isolation you develop symptoms like cough, fever, shortness of breath, difficulty in breathing, call the NCDC Connect Center immediately. It is 080097000010, or call 112, which has been linked to the number I just read. Also, stay at home. If you are ill or unwell, stay from others. Clean all frequently touched surfaces with disinfectants at least once daily. Avoid crowds and large gatherings. Cough or sneeze into a tissue. Cover your nose and mouth, and if you do not have a tissue, cough into your sleeve. Dispose of any used tissue and wash your hands immediately. Get information only from official sources through the Federal Ministry of Health and NCDC or your state apparatus. In addition to the well-known advisory, I'm recommending that all families be aware that the elderly among them are the most vulnerable and should be specially protected from needless contact with children and persons who could be positive for the coronavirus infection. The same should be said for all persons who are known to have underlying diseases such as tuberculosis, HIV, cancer. These people are particularly vulnerable and they form the largest segment of the fatalities. The NCDC hotline is active around the clock. It is toll-free, meaning that you can call at no cost to yourself. Various other states have also set up their own hotlines that you can call for direct state-specific questions. We are working on increasing the call capacity and especially on improving the connection of 112 to the NCDC number. We urge citizens to use these channels for legitimate reporting and inquiries and not for fun. And I urge all Nigerians to obey directives issued by the federal and state government and adhere strictly to the social distancing measures. Together, I believe that we can beat COVID-19. Thank you.